Hi, welcome to Case of the Day, and we start a new week, and this is the 56th case confirming tuberculosis of the upper cervical spine. So, this was a 27-year-old who had an MR done a week or 10 days ago, and this destructive C3 lesion was found as marrow change at C4, C5. You can see the prevertebral and anterior epidural collection on the axial. There's a nice liquefied area here, no cord signs, and so this typically at in a 27-year-old in India would be TB or tuberculosis unless proven otherwise. And perhaps 10, 20 years ago, this patient would have just been put on anti-TB treatment, and then you kind of hope for the best. But because we can biopsy these lesions now, the patient was referred for a biopsy to both confirm the diagnosis and, if it turns out to be TB, to check for sensitivity before starting treatment. When the patient came, I decided to do a contrast study just to reconfirm where the most necrotic part was. So the prevertebral soft tissue goes from C1 to C5, but the most necrotic is opposite C3. But then the question is, how do you biopsy this? What are the routes available? So there's this posterolateral that the green arrow shows, maybe an anterolateral approach in front of the carotid vessels, and then, or somebody can go transoral, but that usually then is not the domain of the radiologists. There is a trick here. All you have to do is turn the patient's head to the opposite side. That brings the carotid vessels a little more anterior, and we get a lateral approach through the sternocleidomastoid straight in. So you can see here this 18 gauge needle behind the carotid, and it's very safe. There's nothing else that comes in the way. Where in the collection I aspirated material, then changed the angulation, went into the osteolytic lesion to get some histopath material from there, and then came out. And the entire procedure took about 12 minutes to do, and you can see air in the collection here after I've brought the head back into the straight position. I wrote this up about three and a half years ago at ctbiopsy.com, where this was a plasmacytoma. And in this case, I rotated it towards the left side and then went in from the right behind the carotid vessels and biopsied this. And you can read more about this if you want to hear. So the gene expert report came over the weekend. It was MTB positive, rifampicin resistant. And that is why it is important to biopsy all suspected spine infections, even if the diagnosis strongly suggests tuberculosis. Apart from proving the diagnosis, we need to know whether the disease is resistant or sensitive to standard therapy. That's the WhatsApp channel. Thank you so much for viewing this, and I'll see you tomorrow.